A very good evening to you, and thank you for speaking to us, Dr. Mkanda. So let's first start with, what are the certification criteria for polio eradication?
So the certification criteria are that a whole region, not just a country, for Africa, it means all the 47 countries have to show that they have not had any wild poliovirus for the past 3 years. And also there should be some good improvement in immunization. That's what are the main certification criteria. I would like to mention that for the African region, the last case was in August 2016. So already last week is 4 years since we had the last wild poliovirus case in the African region.
We'll get to that case of 2016 in just a moment, but I want you to talk to us through the decades-long studies, the process of documentation and analysis, especially of surveillance, immunization and laboratory capacity that you were doing.
So what happened is that although the WHO regional director is one which gives the declaration, but they appointed an international independent committee of experts who have to look at the data in terms of surveillance, look at the data in terms of immunization, conduct verification of that data by going to the countries to go and verify if indeed when a country is saying they have not seen any case of wild poliovirus, that they have indeed not seen any case of wild polio virus. So after looking at this evidence, which they started looking at in 1998 when they were appointed, so we're talking of 22 years ago, they've been looking this meticulously, and they've come up now to say that indeed we are convinced that there is no wild poliovirus in the African region, and therefore we do certify.
What were the findings, if you're looking at the wild polio virus, that strain, and comparison to other strains?
So what happens for the wild poliovirus is that it's why it's called wild, because it's still wild. It spreads very, very fast. It gives paralysis far much more than other strains. This is the natural virus which has been there from time immemorial, from the times of the pharaohs, all the time, been paralyzing people. And we have got evidence of that. So it is called indigenous wild poliovirus. And then we have other strains, as the corrector said, what you call the vaccine-derived poliovirus. That's the one when a child is vaccinated, that vaccine doesn't paralyze that child. But since you take it orally, you excrete it in this specimen, these two specimens. And if there's bad sanitation, then that virus mutates, and the variant of that then can cause a paralysis if it finds a child who has not been protected or not been fully immunized. So those are the different types. What I'd like to say on this is that the control of these other forms or the other strains is not very difficult compared to the wild one, because of it doesn't spread as fast, and we can be able to stop this. We were seeing already with this strain that when we started mounting very strong, rigorous campaigns, the numbers were going down. It's just that we had to pause a bit because of the COVID. We didn't want to show like we are spreading COVID by continuing with the campaigns. But we know we have the expertise and the vaccine to stop this other form.
Dr. Mkanda, take us through, and I know, as you say, the studies began in 1998, but in 1996, when the commitment was made to eradicate polio, wild polio, it was then found that 75,000 children were being paralyzed annually. And I want to understand what doctors knew then, also in comparison to, say, something like smallpox, which I think we were declared free of 40 years ago.
Yes, I think that's what makes it a very big achievement, historical achievement, that indeed this wild poliovirus is only the second virus to be really eradicated on the African continent after smallpox 40 years ago. So this is really a historical achievement. But what I'd like to say is that what happened in 1996 followed up on what was agreed globally in 1988 by the World Health Assembly, where it was agreed that by the year 2000, we should be able to eradicate wild poliovirus globally. So the progress was slow from that declaration. It only took until 1996 when the African heads of states, then it was called the Organization of African Unity, met in Yaoundé in Cameroon and made a declaration and commitment to re-eradicate this virus from Africa. And then soon after that, they had to have a champion to really make this cause or this commitment go. And Nelson Mandela, who was the president of South Africa, who was, together with Rotary, championed this, calling all the African leaders to really take this commitment very, very seriously, mobilizing the communities, mobilizing a lot of people, soccer players and everything, in what was called the Kick Polio Out of Africa campaign. So from then, we started to see a lot of investments. We started doing campaigns. We started improving in surveillance. And we started seeing that the number of cases of white polioviruses were decreasing. With that decrease, then we became confident that indeed we can stop this virus from Africa.
So you mentioned earlier on the vaccine-derived poliovirus outbreaks. We're still seeing in 16 countries. What do we know about that, and what do we need to do to combat that?
So as I said, this is, as its name calls, vaccine-derived poliovirus. What we need to do is exactly what we have done with the white poliovirus, and that's increasing surveillance so that should we have an emergence of that strain, we should be able to respond very, very quickly with very high quality campaigns. I'd like to mention that where you're having these strains are areas where the children are not fully vaccinated. So what we need to do is we need to be bringing the children to be fully vaccinated so that when this strain comes into contact with a child, it will not cause any paralysis. Still, what is very important is to have the children fully vaccinated against all types of polio. So that's what I would really urge all of us as communities, parents, guardians, to ensure that we really have our children vaccinated. Vaccines work.
And the reason I ask this, Dr. Mkanda, as you point out, is because of under-vaccinated areas. So is it possible that wild polio itself can resurge because of this particular strain? And what do we do to ensure that there is no resurgence?
So the resurgence, if we have any cases in the African region, in Africa, it will be not coming from Africa. That independent body of experts, which I talked about, they have done a very meticulous job. They've gone even to the most difficult places, Boko Haram occupied areas, to really look and verify that we don't have this white poliovirus. But the risk of having white poliovirus comes from outside, in countries which are still endemic for white poliovirus. You know, we have Afghanistan and Pakistan. And with the travel which we do, people can bring that virus back into Africa. So once the children are protected, it means even if that virus comes in, it won't be able to paralyze children. So that's what we really need to do for us to protect ourselves and maintain these gains. There's still a threat coming from outside. On the circulating vaccine-derived strain, which you talked about, it's the same thing. They're all viruses. It's an issue of building up a wall of immunity by ensuring that the children are vaccinated. Once you do that, so what happens is that even if those who are excreting this virus into these poor sanitation areas, it will not be able to propagate or continue able to transmit, and it just dies on its own because the children are already protected and it cannot paralyze or infect those children. So by the end of the day, we still have to improve our vaccination, our routine immunization, our surveillance, and where possible, where we have to improve coverage very quickly, do some additional mass campaigns so that we can really boost up the population immunity in those localized areas.
Thank you so much for speaking to us and sharing your insights with us. Dr. Pascal Mkanda, he is with the WHO Wild Polio Virus Coordinator for that program.